All right. Let's get into our conversation for the hour now. It is around the voice health and disorders. We have in studio with us someone who is not just an ENT, but also a neck and head surgeon. That is Dr. Nicholas Ngugi. Good morning, Doc.
Good morning, everybody.
Good morning.
Good morning. Thank you for having me.
Kabla tuanze.
Floris, with a good voice,
Yes.
is going to give you the day's quote.
You know, like how the principal summons you and you have to make sure you're on best behavior.
Yes.
The doctor for the voice is here. I'm like, I hope I sound okay. So today's quote is courtesy of James Baldwin, who's an American writer and essayist. And he's known for work on race, identity, power, and society. And the quote is, not everything that is faced can be changed, but nothing can be changed until it is faced. What are your thoughts on that?
I think it makes good sense. It's an interesting quote. There is some element that you have to get to do something. You have to do something to change something. So you must take charge of whatever it is that you want to do. Even if you do not succeed, you gave it a try, and you know now that no matter what you do, you might not be able to change. But it's rather to have tried, to have done something, than to have regretted saying maybe I should have, or if you did nothing, you'd never know.
Correct. Love that.
Very good one. Doc, let's start with just understanding what you do. Because we see some ENT, ear, nose, and throat surgeon. Now you have added neck and head into this.
So there are very many. So ENT is just basically a big group of like specialities within it. So generally we do everything that deals with the ear, nose, and throat. Now, I specifically specialize with what we call head and neck surgery. So head and neck surgery is technically lumps and bumps of the head and neck, anything below your eyes and above your chest. So we're talking about any growths, any cancer. In fact, that's usually my main line. But we also deal with anything that grows within those regions. So if you have anything that grows inside, on your face, on your nose, on your tongue, in your throat, in your ears, on your ears, on your neck, in your neck, so those kind of things. So that's usually now what now comes as head and neck surgery. We have other groups like those who deal with the ears, we call them otologists. Those who deal with the nose, we call them rhinologists. So I tend to specialize in lumps and bumps of your anything below your eyes and above your chest.
Do you go into the head?
Yes. Your head is
anything inside the
not
head?
into your brain. That's somebody else's domain. But like in your ear, in your neck, in the side of your face, we have this glands outside of your neck called parotid. So those we tend to specialize in. Other things that go in your nose that go almost towards your brain, those we still deal with.
So today we want to focus on voice. Where does voice come from in all those places that you've mentioned?
So your voice actually comes from, let me put them in two basic areas. So you have your voice box, okay, which everybody knows. More easily to see in gentlemen when you say Adam's apple, that whole region. And your nose, your throat, that is the back of your mouth, back of your nose, your mouth, your tongue, your cheeks, all are involved in making voice. So your voice comes from so many places. That's why when we talk about voice disorders, we will be involved in very many things that not only just deal with your voice box.
Okay. So what's a healthy voice?
A healthy voice is one that is one in which an individual is able to have good pitch, able to control their own loudness, does not break, does not cause pain, does not cause strain, and is comfortable to the voice user for them to carry it out for extended periods of time. And when we say extended period of time, it's generally like what you can talk for a good amount of time without getting fatigued at a good volume, at a comfortable pitch.
What's a good amount of time?
So that depends, because for example, if I was to say an accountant, a good amount of time for an accountant would be maybe talking about something or talking to a client maybe for 10, 20 minutes. For you guys, it's different because you guys are professional voice users. You've been talking for the last couple of hours and you're going to need to talk for the next couple of hours. So for yours will be different. Now, if we were to get a singer theirs would also be different. So it just means that whatever you're using your voice for, you're able to do it for the duration it's needed, comfortably, painlessly, without much effort.
Okay. Now, voice health is not something we think about much, I'll be quite honest.
Yeah.
It's occasionally people will, you lose your voice, maybe you have a cold or you strained it. And then it's like, we were saying kunyo maji moto, ginger, lemon, honey, and all shall be well. What is an unhealthy voice?
So an unhealthy voice is one is breaking. So one, what we call hoarse voice. Hoarse voice technically means you're talking, but your voice is not your voice.
Yeah.
So if I was to come today and say, hey, how are you guys? I can speak, I can communicate, but that's not my voice.
Yeah.
So you can have a breathy voice. So one where, I usually like giving the analogy of if you get hit somewhere very hard and you're trying to communicate that you need, and you're trying to get the air out, but or voice that you're in pain, but only it's kind of is air, that's a very breathy voice, all right? Or if you find like, like Viola Davis in her scenes and she's acting and her voice pitch keeps going up, down, up, down, up, down, up, down. She's not able to control and communicate that whatever she's trying to bring out in an even tone. That's also a sign of an unhealthy voice. Those are the commonest things. The other things that happen is, like you said, when you have a cold and you have this sort of like blocked nose sensation and a nasal speech. Yeah, some people think it's posh, but usually sometimes it's because something's going on somewhere else that's affecting your voice. Your vocal cords might be okay, but something has either grown in your nose or blocked your nose, or even like when you have, bit your tongue or you have something growing on your tongue.
Yeah.
Then that will also affect your voice.
And I think I like that breakdown. So is there a situation where someone could be born with a voice defect that then, they just grow into it and they kind of have to manage it? Outside of course, you, Grain, and we look at maybe the life cycle of our voices, because our voices change over time, correct? So let's look at kids and then come to the grown-ups. Okay. What are the changes we experience with our voices?
That is a very beautifully set question, because yes, there are very few people who end up having a voice disorder from birth. Usually if you have anything that has happened to your vocal cords from birth. Now the thing is, if they learn to manage it, that becomes their voice. We've had like young girls, 6, 7, 8, with like Eric's voice, like deep. And we do everything. Vocal cords are moving beautifully. There is no mass. The child is not in pain. They even sing with no issue. That becomes their voice now. Okay, because now that's what you're born with, that's what you adapt with. Now, for children, mostly we don't get much issue with voice up until now. Young boys get into point of teens and preteens, and then they start having those issues of your voice is changing. Now, that is physiological, that is normal. Yeah. But for some boys, it does change, and they have voice misuse for one reason or another. The other things that happen now come to ladies as we get older. Now we're talking about in your 20s, in your late teens, 20s, whereby now you ladies tend to be affected by a change in their voice. Okay, naturally happens, hormonal, but for some of them it does become worse because either you're very good at using your voice. Let's say you're in high school, you're singing, and your voice starts to change. Okay, it is a normal change that happens and can happen episodically, hormonally, but now it affects you and affects you psychological. So most people tend to come during this point and have other issues. Also, it's also the time when people tend to get what we call psychogenic voice changes. So you get either spasms of your voice, or you have emotional turmoil, and it manifests as voice changes. All right. Now, as we get older, voice tends to change more in ladies than in men. Okay, especially when we talk about people above 60s, you lose some of the fat, some of the collagen and elasticity of your vocal cords, happening more to ladies than in men, and then your voice also gets deeper. That's why if you ever noticed, if you grew up when your grandmother was younger and you saw her as an adult, you noticed that her voice kind of got a bit more raspy. She kind of moved away from choir. And in my practice, I tend to see also a lot of ladies coming at that general age, mid-50s, mid-60s, you're having problems now with choir. You want it, you've been in it, your voice is generally good, but you're noticing, I'm not holding pitch anymore, I'm not holding tone anymore, I can't hit the high notes like I used to anymore. So that happens as old age voice, okay? And there are treatments for most of these things.
Okay.
Wow.
That it gets deeper as women get older. Okay. Is there such a thing as like your voice changing and acclimatizing to your surroundings? My theory is my voice has gotten slightly deeper in the last year of Fixing the Nation because of being next to Eric and Janet and now Felaris, who have very deep voice. Can it be psychological as well?
So you do change your voice also sometimes also because of your environment. For example, certain languages need you to have deep guttural voices, like French. If you in this country, if you're speaking Luya, rather than when you're speaking Kimeru and Kisi, which would be a bit more
Higher.
Or
not
cow.
really higher, but it needs your voice to have
Higher
sort of
pitch.
Not a higher pitch per se, but the way it doesn't need you to be deep.
Right.
It doesn't need a deep voice because you lose some of the words because small things translate differently.
Yes.
Okay. Where
Yes.
simple how you say how are you and how are you
Yeah.
become very different meanings in those languages.
Yep.
Right.
Okay.
Also, it's also an affectation. So just because you hang out with them, you try to mimic their voices. Same thing with things like smiling. You will smile differently depending on how you were raised with your family. That's why sometimes spouses or people who've been dating for some time tend to look a little bit alike.
Yes.
Because same thing with sneezing. People from the same house sneeze the same way. Because you see how your dad sneezed, and that's how you sneeze, and it tends to go like that. So voice also works in sort of like a similar way. You're with people who either you admire or you look up to, or who have raised you or taught you how to speak. You will tend to speak like them.
Okay. When is it time to worry about something being wrong with the voice?
If your voice changes, then, all right? When your voice changes, immediately you notice this is not how I usually speak. Seek help. Most times, for most of us, it's common cold, put you on some meds, or even just tell you, just observe, hydrate, get some rest. That's basic enough. Even if you've been out at a concert and you know the reason why your voice is hoarse the next day, seek help, all right? Because everybody else was at the concert, they were shouting, screaming. Why is it that only you are coming to the hospital? Why is otherwise my line would be from here to Timbuktu? But come and find out what exactly did I do to my voice? Did I strain it too much? Did I injure it too much? Because a lot of times what happens with a lot of people when they get what we call muscle tension dysphonia or spasmic dysphonia is you used it and you abused it, but then you continue to abuse it without knowing, because now you're in an injured state. So imagine, I usually give patients an analogy of you went out, you played football, you got a sprain, you started limping, and now you limp everywhere. What's going to happen to that ankle joint? What's going to happen to that knee joint? What's going to happen to that foot? Because you are putting abnormal strain on it, and that's what happens now later on, is that now you say my voice has been like this for the last 6 months, 1 year, because of after one incident. Whereas you could have come, we see you, we say, okay, hey, you need to go on voice rest, you need this kind of therapy, we need to put you on, we need to investigate you further and follow you up to make sure that you're using your voice appropriately.
Okay.
I mean, this is very layered, and I'm just thinking about how we've really normalized hoarse voices, and kumbe someone is walking around with either messed up vocal cords and they're like, oh my God, it sounds so good. No, you don't sound good. Go see a doctor. Let's look at lifestyle habits and how those affect voice.
So what happens with a lot is that if you have anything that is causing injury, trauma, or abuse to your voice, they will change, or your voice box. All right, let's focus now, let's say, on the voice box, because that usually tends to be the one that's usually easier to nail down. All right, first things first, voice overuse and abuse. Overuse is you're talking forever, shouting, like let's say you go to a party and you're always shouting, or going to a very loud place and you're abusing your voice, and that happens to be something that you do continuously, you will end up having problems. Professional voice users like teachers, you guys, singers, because of how much strain you put on that, that becomes something that you do. But it becomes very tricky because that's your livelihood. The other thing that happens, especially for us in our society, is a lot of smoking. All right, be it normal cigarettes, be it vape. In fact, we find vape tends to be a lot worse than the cigarettes, generally because of how heat is dissipated in a vape. It's good for second-hand users. Like I was using it, she's not going to notice, or she's not going to get the effects of what I'm doing. But it's solely focused on you as an individual, so it does affect you. The other thing is getting acidity. Now, I'm going to put it as just vaguely acidity, but mostly like reflux. And reflux disorders. And foods have changed over time, and some of us have food allergies, others have, used too much of, acidic foods, or you're taking too many things, or too many processed foods, and it's not agreeing with us, okay? Lifestyle in how we also affects us is that now you get a little bit of acid always trickling up. So that constant burning, constant irritation kind of also comes into play with your voice. All right? Now, I used to get this question about how come the Makangas don't get voice disorders. They do. They actually do. And the way you said it, it has been normalized, and it's such an unfortunate thing that hoarseness of voice is so normalized thing, especially in men, where one of the let me give you voice throat cancer, laryngeal cancer is very prevalent in this country. But the problem is that it's not painful. It comes with a hoarse voice. People have a hoarse voice 1-2 years before they come and see me. And by the time they come to see me, what we're going to have to do is going to be very drastic. Rather than if you came early, treatment is very easy. I can even tell you, assured that you would see me in 3 years' time, and this will be a forgotten story. We'll not be discussing this. It'll be like, oh, I went to the doctor, I had a hoarse voice, he said I had this, and I got treated. Now I'm fine. Like nothing, like another day you just got a cold, and that story ended. But that fact of normalization is what is actually coming to hurt a lot of people. Other things that happen is that even with the ladies, that now you want a deep voice, it sounds nice, it sounds bass, it sounds sexy. And then you end up having vocal cord nodules or polyps, and you need your voice. Yeah, if you're, nowadays we do a lot of talking on the phone, we do a lot of Zoom meetings, people can't communicate with you, they can't hear you, they tend to be off-put by you psychologically. So in so doing, also comes to affect you in other, not only your pocket, but also in your health.
Yeah.
We'll get into those cases where somebody must come and see you, and the very many things that you've dealt with over years when it comes to voice. I want to just ask the question of seeking to understand what happens when voice is being generated. Like, can you walk us through that? We hear about this voice box thingy and so on and so forth. What exactly is happening?
So, you have... so let's start, we're going to start from down. So we're going to start from your lungs, all right? You have air, you're expelling air. Now, as you're expelling air, you have your voice box. Your voice box technically is a little valve, all right? Has these two little things that look a bit like this, like a small little triangle, and with a bunch of muscle, a bunch of tissue, some ligaments, membrane covering it, and it vibrates, all right? The best analogy I like to give for this is when we were younger, we used to have this game where we used to pull an elastic polythene bag, and then you blow.
Yes.
And then you get, the tighter you blow it, the finer the whistle can be.
Yes.
Same thing with your vocal cords. They're tight, they need to be tight, okay? They need to be dry. And they need to, so they need to vibrate, because that's what happens when you have a cold, you have a lot of mucus in that area, and hence, right? Same thing also with when you have a lot of reflux, guys go because of that mucus there, then gives you a weird voice.
Yeah.
So they tend to be, and when I say dry, not being like dry like at the table, just dry like the way the membranes of your body are supposed to be. All right? So in that happens, so you have that vibratory function. Now that's where majority of your voice will come through. Now, as that air is vibrated out, you get sound. Now that sound gets modulated now. It goes the back of your nose into your sinus, the back of your mouth, back of your nose into your sinuses, and you get reverberation or amplification. All right. Hence why when your nose is blocked, you sound a bit funny.
Yeah.
All right. Then it comes out throughout your mouth, your cheeks, and your tongue. Now your tongue comes and articulates that sound, so it helps it now, makes it a lot better.
Words.
So even if I say, how are you? not moving my tongue.
Yeah.
You can hear part of it, but I'm not articulating that. So it kind of breaks it up better so that you now get a voice. So that's why I'm saying voice comes from very many parts of your ENT.
Okay.
Wow.
So here the sinuses and the nose are like the muffler.
Yes.
Yes.
You know, as a volume.
Yes.
So let's take a break. At 28 minutes after 7, we're having a conversation with Dr. Nicholas Ngugi, who is an ENT, neck and head surgeon. We're talking about voice health and voice disorders. And please take a keen listen to what the doctor is saying, because he's saying there are very many people who ought to be seeing a doctor who are not, because they think, I'm okay. I just sound okay. Back in a moment. Having a conversation with Daktari about voices, voice health and voice disorders. Dr. Nicholas Ngugi, ENT, neck and head surgeon. Falaris, you had a couple of questions for Daktari.
Yes.
We want to get here.
I mean, of particular interest is, of course, now start to talk about lifestyle diseases, okay? And I wanted to understand two things. One is the diagnosis part, where, a lot of Kenyans go largely undiagnosed, and how access to specialists like you, if I'm living in another part of this country, where would I go? I've started identifying, I'm like, yeah, there's something that needs to be checked there. And second is the treatment aspect of it. Is it affordable? Is it something that maybe it's, how long does treatment take? Do we need to rehabilitate the voice? Because I've had instances where someone has been told, yeah, we need to rehabilitate your voice. What does that look like? Why are we taking voice to rehab?
So let me start with the first one. When it comes to diagnosis, one of the things I like to say is, if something has troubled you for more than 2 weeks, seek medical help. You'd rather be told it's nothing than have something sitting and festering.
Yes.
The second thing is that voice issues and voice problems sometimes get diagnosed, like we say, we've normalized a few things. But where can you get help? Most times, most county hospitals, or the large county hospitals, let me call them, when we go back to districts, the large level 5s, the district hospitals, most of them nowadays tend to have an ENT in the facility, or at least a physician who's be able to diagnose that you need to be seen and be either referred or have more specialized diagnosis or treatment. Now, when it comes to diagnosing some of these voice problems, first things first is we look. Okay, we talk to you, we see how you're doing. You tell me this voice of mine is not the same. It's blah, blah, it's 1, 2, 3. We ask certain questions about how your quality of voice has been, when it started, how it's been, has it gotten worse, is there pain, are you fatiguing in terms of your voice? And then from there, we take a look. Taking a look is simple. Open your mouth, say, let me look inside your nose. We might get a camera, usually put it in your nose, see if there's any obstruction in your nose. Take it down all the back of your mouth, see if there's any obstruction, anything growing. Usually we use something called a flexible nasal endoscope. Looks like a little, thinner than the mic cable. Put it down your nose. It's a camera that allows us to see all the way until your voice box. Then we make you say, if you're a professional voice user, I might even have to make you sing. Okay, or read out something, but just to see what exactly is happening. I'm looking for growths. I'm looking for excessive saliva. I'm looking for things that are not supposed to be there. All right, as well as seeing if your if the movement of your vocal cords or the movements that are made when you're voicing are appropriate. Okay, so is it closing well? Is it closing completely? Is there a place that's closing but opening up in the middle of your voicing? So those are the things that we'll be looking at, and then we treat accordingly. If there are growths, sometimes we remove, and there are some growths we don't remove. There's some that we need to take something called a biopsy, so that means I have to take you to theater or pinch out some of that tissue and take it to the lab and see what exactly is happening. All right, and this can be biopsied from anything from the point when we put the camera inside your nose all the way down to your voice box, or even sometimes below. Okay, because remember what I said, we start from the lungs coming up. All right. Now, once we find out what the problem is, we'll treat accordingly. Now, rehabilitation. Now, some things might require how cost effective is treatment. So, depends on what your problem is. Okay, voice use and overuse and abuse, which is a common thing, common cold, laryngitis, or the flu that has caused you, very cost effective. Sometimes if it's the cold, we give some antihistamines, which are cheap. I think Piriton, I think is usually in most government places it's less than 30 cents. All right, so it's easy. Some people like the way you say hot water, lemon, ginger. Actually, what works in that situation is actually the warm water and the honey, because the honey is actually very good. That's why we give it to kids, and it's been traditionally given, and we still even recommend it now. Some warm water with some honey for their sore throats, their cough. It moisturizes, it coats the throat, it coats the area, reduces the inflammation in that area. Very simple remedy. The other thing is voice rest. And most people don't like this, but I tell you to keep quiet. No humming, no singing, no talking, no shouting. If you have to talk to anybody, text them or write it down. It's very hard, but it's cheap. Doesn't cost you anything. Okay? That's usually the hardest part for most people to do, because what you're allowing that voice box to do is rest, and you're allowing all the tissues that are inflamed to calm down. They're not rubbing on each other all the time. Remember when we said voice is about vibration, so you're not having those vibrations. Okay. The other thing we do is usually change diet or change a bit of lifestyle modification, especially if a person who's having issues with reflux. All right, propping up your bed, not eating not eating and then going to bed. So you're giving yourself at least that 2-hour, 3-hour time window before you get to bed. Making sure that you are conscious about what you eat, in terms of, if I eat this, I tend to get a lot of burning stomach, or I tend to get a clearing of the throat a lot. Then try to avoid some of those things. Breaking up your meals to smaller, manageable portions, so we're not gorging ourselves all the time. The other thing is, when you sit to eat, sit and eat. Sit on a stool with your back straight, making sure everything's going straight down, not hunched over the sofa or the bed, eating in bed. There are things a lot of things that we can change, that are usually cost effective. Because if you treat that early, then it becomes easier to treat something else that has changed later on. Also, in terms of, even think about economics of health in terms of the country, I'd rather treat, it's easier to treat 100 people with, hoarseness of voice because of abuse and use, or, you having laryngitis early, rather than you come to me with laryngeal cancer. That's even in terms of what the resources will be draining in terms of countrywide, or in terms of you as an individual, will be quite fast. Now, the last point for rehabilitation, yes, we do take people to rehab, okay? And it's just literally what we call it speech therapy, okay? But it's also voice rehabilitation, teaching you to use your voice appropriately. So, for example, I'll give you an example like for you, all right? You can hear that, all right? You find yourself having a bass that gets deeper, or as the show goes on, you're unable to carry your voice. Remember, the beginning we said that would mean that your voice is unhealthy. So you come to us, we teach you how to project your voice, that it's not shouting, okay? Using your voice appropriately in a normal way, in a comfortable way, to a point where we reach where you can comfortably speak at a good pitch, where you and I don't need mics to communicate to each other, but you can be able to hear me through the entire show. So we do, and especially that happens more for teachers. We do that a lot for teachers, a lot for guys who do a lot of Zoom and on meeting presentations and marketing.
Na watu wa Marimari.
Yes.
Marimari. That guy just says that and he's heard across like a 1 kilometer radius.
So that's the thing. So some of those guys are projecting appropriately, and you will not see them having a problem, because when he switches back to his normal voice, it's like a singer. He's like a singer during that point. He's able to project his voice appropriately, and then later on, his voice, because even when you speak to him, he's not, most of those guys, you will notice, they don't have hoarse voices. They have clean voices, because they're able to project.
Okay. My question is always, sounds good, Ikwanda Sha.
So depends. Yes, if I'm treating you for laryngeal cancer, yes, that is under SHA.
Boy, the extremes.
No, let's start with this.
Biopsy.
If you just want to go and have, I mean, are you saying that we should be going to have like just regular checks? Like, mimi sijui sauti yangu kwa saje, nimekuja uniambie. Right? Because we say, seek those primary healthcare services. Take yourself to hospital. We need to have kwanza men. Go to hospital. So can I go to a level 2-3 facility and just say, I've come to check my voice?
I don't think that will be, you won't get much in terms of ENT service there, but
Okay.
hopefully you get a clinician who will be able to tell you, okay, this sounds like something I need to refer. This sounds like, if it's a common cold or something like that, that should be, even a level 1 should be able to sort you out.
Okay.
All right. But anything under level 5, I don't think you'll be able to find an ENT who now where you'll be referred to and say, okay, this one needs this specialized treatment or this specialized investigations, and then, or I will need to refer you to place like KNH or KU or Jaramogi Odinga, those, or Coast General, where you know it's a big facility where they have some of these things available.
So in what circumstances, because you see, SHA and the Ministry of Health are discouraging us from just taking ourselves straight to Kenyatta and straight to a level 5. Under what circumstances should I go straight to a level 4?
Straight to a level 4, actually, like I said, if you notice your voice is not your voice, and it's not getting, you don't have a cold, and it's been there persisting for more than 2 weeks, go to a hospital. It doesn't matter which hospital. Go to the hospital.
Okay.
Let them tell you it's nothing. They will tell you this can be dealt with at the level 4 or the level 5. Let them be the ones to tell you this is going to happen. This is what needs to happen, rather than staying at home. Yes, you could come, like, for example, give an example of KNH. You could come to directly into KNH and you say, this is the problem. There is a screening protocol that the hospital has in terms of, we see you, we see this, does this need specialized care? Let's investigate and then see, okay, now this one can be downgraded. You can go continue care at Mama Lucy, or this one now needs to stay with us. Okay? Those facilities are there. They have been there. All right. Now, whether they're covered on the social health insurance fund, not really. I can say for the ones that when it's have to take you to theater, that one is covered by SHA, and that is in the public space.
Hospitals,
you have cancer that needs to be removed, that is covered. You have polyps grown on your vocal cords, that is covered. There are coverages, but not everything is covered. All right. So if you have growths that need me to do specialized things, like, for example, there are people who get growths that need to be excised off the vocal cord, but the vocal cord needs to be left intact or shaved very slightly. Usually we use a laser machine, and that sometimes is not covered. Yeah.
All right.
You know, and this is where I think the challenges will continue being with us. One, there's no clarity of what's covered and at what level, and for what facility, for what service, right? So SHA may have it. Some facilities, and especially the administrators in the facilities, may know, for this one, we can claim under SHA, for this one we may not.
Yeah.
The practitioners, you just know a patient has come in, I'm seeing a patient, I'm dealing with the patient. The hospital admin will deal with the payments and so on and so forth. I think we need to have wider knowledge of these things, because it will then encourage people to seek health services.
True.
If you go outside of the urban areas and you're saying that I cannot just walk to my local dispensary and go back home, if the local dispensary tells me to go to the sub-county hospital, which is going to have some cost element into it because of travel and all, that there's not going to be an extra cost element because SHA will have taken care of it, then I will go.
Yeah.
But if I'm thinking fair, nifike pale sijui nitambue ni pesa ngapi, nianze kuitishwa maybe 5,000, 6,000.
Yeah.
So I will just think, I don't have more than 1,000 shillings. I will not go to hospital. So people will not go to hospital for this reason.
True.
What do we need to do so that people actually go to hospital without fear about this money business?
I think if you were to ask me, I think what should happen is, in terms of the specialized care, it should be that you have already a template, a referral system. One of the things that's become a big problem ever since I think we went into county system was that we don't have a clean referral system like we used to before. For example, I did my internship in Meru, right? That was part of the Eastern Province. So if you're from Isiolo, you're not referred down to Meru. okay, you're referred to Embu. Embu now refers to KNH, all right? So you have, the way they staffed those areas was accordingly. So you'd have more specialized people in Embu based there, so that when they're referred there, you can be able to be taken care of. You have an ambulance system that's able to take care of patients. It is true that a lot of patients don't seek healthcare because they are worried about healthcare bankrupting them,
Yes.
or getting into financial ruin, because you just, like Erica said, like you have a problem, you're in Mwea.
Yes.
You want where you're like, okay, I go to the facility, there is no, it's not covered there, or I have to be referred to Thika. Now you take a bus or a matatu all the way to Thika, then you get to Thika, you find my friend Josephine there, and she tells you, oh, this I need to do a video laryngoscopy, I need to put a camera in your mouth, it takes literally 5 minutes, and we find out what's happening with your voice. Then you're told there's a cost to that, because you remember that this is an outpatient service, it might not be covered by SHA. And then now you're like, oh, how much is it? Then she tells you maybe it's 1,000 bob. And you're like, it's already 200 plus to get here, and 200 go back, and now I'm being asked for another 1,000 shillings. I have not even eaten anything, and then now after that, just to be told, okay, fine, yes, you have 1, 2, 3. Here's the prescription.
Down.
You'll be then you still pay for those things.
Yeah.
So if there's a way that the system allows you to be escalated at almost like socialized healthcare, but at a reasonable rate, where if something has not been found out, then I think maybe the cost should not be incurred on the patient until now we know, okay, this is 1, 2, 3. Prepare yourself. This is what you need to have done. You need this kind of cover. You need to now move to a tertiary facility, or we are downgrading you down to a smaller facility because now you're able to manage. Yeah.
Well, what do you mean? A socialized system like a social health authority? Quick question from Francis Odhiambo, 7485. Good morning, Fixers. Please talk about voice loss due to trauma, stress disorders, and drug and substance abuse. How do we detect these and control measures?
So I'll start with trauma. Trauma is usually one of it's kind of a bit scary because it depends on how the trauma is. All right, clothesline injuries are very difficult to deal with because one, you're breaking cartilage, you're literally breaking the voice box. Okay,
What did you call them? Clothesline.
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 Yes.
Okay.
Yeah.
Okay.
How do you put it? It's when you have the line for the clothes,
Yes.
and you run into it, and it's
Yes.
it's kind of like chokes you.
Yes.
Okay, those are very difficult to deal with because they tend to break the cartilage. They also injure the nerves. So you could heal very well, but because you already have a nerve injury, which takes very long, usually take about anything from 6 weeks to a year to resolve, those become very difficult to deal with. But those are very easy to detect because you will come immediately because you'll have difficulties in breathing, your voice is horrible, you can barely speak. Those ones, the good thing, they come quickly.
Okay.
Substance abuse now becomes problematic because you have different things, substances, especially inhaled substances, like if you're going to, like the Americans have, I think, crack. Yeah, it tends to cause a lot of laryngitis, vaping of other harsh chemicals like heroin, those very harsh, burning, and cause a lot of inflammation in that area.
Yeah.
Most of those people, you will notice that they will have changes, and the problem is that they will not come because they know there's a substance problem.
Yeah.
But if you know somebody's having those kind of issues, the best is to at least try to see, can you solve this problem, one problem at a time, all right? But sometimes holistic treatment of them is usually what helps resolve. They do have sometimes lasting complications because they tend to get a lot of fibrosis. Think of it like chronically injuring your voice box, the back of your nose, your throat, your tongue. So all these areas are kind of having element of what we call fibrosis. So they're going to heal with some scar tissue. Scar tissue is very difficult to remove because as far as your body is concerned, that area is fixed. And if you remove it, it will fix it again with the scar tissue. All right.
Okay.
Now, the last part was
Stress disorders.
Stress disorders. Now, that comes in many forms. So I'll give the younger population and the older population. Most of the younger guys come in with stress disorders will end up having problems with either mutism, okay, not able to speak, nothing's wrong, all right, or they get spasmodic or spasmic voice problems. So you're so stressed that your muscles are just almost like in a constant state of firing. So you get a very poor voice. Psychologically also affects them. So then it now kind of has a sort of like roles snowball effect.
Yeah.
Your voice is bad, psychologically affecting you. Because you're psychologically affected, you're stressed. You're stressed, your voice muscles increase, stress hormones. It just rolls.
It's a
rolls,
loop
rolls, rolls.
of-
It's
Yeah.
a bad loop.
Yeah.
And usually it's very difficult. It just requires a lot of most of these patients usually simple voice hygiene and therapy. Find out what is causing the stress. Sometimes it could be something simple as, I'm not going to say simple, but something like exams. It'll come and pass, but they don't know that. That's their part of their life. That's
Yeah.
a challenge that they
Yeah.
have to deal with. Now, for the older adults, it now becomes problematic because what tends to happen is that their voice tends to break a lot, or they tend to lose their voice a lot. Okay. Usually comes because they are now misusing their voice. They understand their stress. They're trying to fix it or try to go over the stress. So you're emotional or you're having a hard time dealing with something, and you're trying to soldier through it.
Yeah.
And tend to have a lot of abuse of your voice. So speaking either very harsh tones, very shouting. And in so doing, you easily develop things like vocal cord nodules or vocal cord polyps. All right. Now, when you come in with all these things, and now we try to treat a physical manifestation of something. All right. But older people tend to at least be a lot easier because now you can give them medication for relieving stress or help them see the stress, understand the stress, and move away
Manage
from
it.
that. Yeah.
But I'm guessing, if you don't treat the underlying
You'll be back.
stress,
You'll be back to square one.
Okay.
Yeah.
My goodness. Talk about the laryngeal cancer.
That's my baby topic, my little baby. So laryngeal cancer is pretty common in this country. It happens more to males than in females. All right. Usually, most guys tend to have an element of or history of having used cigarettes for quite some time, alcohol. Guys who are in woodwork environment, guys who are dealing with a lot of fertilizers, guys who deal with leatherwork. So there are people who have been. Something is going to cause constant trauma to your voice box or your larynx, all right? Very easy to treat when you come early, all right? So usually what happens is this: you come in, you've had your voice that's not getting better, you've been seen by a primary care physician, has referred you to us, we take a look, we see a camera, we put a camera in your throat, we see there's something growing there. We take a biopsy, all right? We tell you, unfortunately, it's cancer, but treatment's easy. So early on, we tell you, pick one. Do you want surgery or do you want radiotherapy? All right? Any of them. Just pick one. And then we send you forward, you get radiotherapy. Doses is not usually even very, very high, but it allows you to keep your voice. Or then you say, no, I prefer surgery. We take you to theater. We can either use laser or some specialized instrument and remove the area that has the cancer. And then we just follow you up for the next 5 years. And 5 years follow-up is usually you come, you see me, how are you doing, how's your voice doing, put a camera in you. Maybe usually the first year we do every 3 months, then the next year we do 6 months, and then next year after that, 1 year. And we're just following you up. Then after 5 years, I tell you, you're cancer-free, go. Now, when you come later, which is most of the time what I tend to deal with, is now becomes problematic because now I have to accept that this cancer has grown quite large. Most times, most guys who come to us sometimes are coming with very hoarse voices, barely audible. Others are barely breathing because remember, the voice box is the valve that goes towards where your lungs are. So you have this growth that is there that's impinging. You can't climb stairs without being breathless. You're seated talking to me and your voice, every sentence you're so means that now you end up having to get maybe like a tracheostomy, which is a tube that's on your throat to help you breathe, that's below the obstruction, so that way that the obstruction is not involved in your breathing. Then means that now when you come in, now we're doing surgery, we're talking about radiotherapy thereafter, and the kind of surgery is quite, it's life-changing because your voice box has cancer. The cancer has to come out. So if it's involving most of your voice box, means the whole voice box has to come out. So now we end up having to take out the whole voice box. We do something also called a neck dissection. So we remove any lymph nodes at the side of the neck. This is just to make sure that the cancer has not spread to this area, or because it's where it's the area around. So that's where we expect it to try to run off to. All right. Then you have what we call a permanent tracheostoma. Permanent tracheostoma is literally where you don't breathe no longer through your mouth or your nose. You're now breathing through a hole directly on your neck. All right. So you will never speak the way you speak again. Okay? And that's usually unfortunate. That if you had come early, this would have been avoided. Usually, but there are other ways of communicating that we can teach you. There is the little little thing that looks like a little torch that you put inside your neck, leaves you with a very robot voice. Most people like it because it's portable, and we have a laryngectomy society. One of the heads is called Bishop. We call him Bishop. He had his surgery, I think, in 1992, and he's the whole bishop, and he uses that to preach.
Wow.
So there is life after. So, and then we have others called we put for your prosthesis. So technically mimicking your voice box, but in a very small form that forces you to force air through. Yeah, but it is manageable. It is there, but come early. The options available to you are there. Treatment is available even from government hospitals. Like it is doable, and we're here and we're there to help.
Tukimalizia daktari, on a light note, kama mtu akona soprano, unaweza mpatia bass.
So it's the funniest thing when you ask that is that everybody's moving to do the other way around. Yes, by the way, we can actually.
Bass, soprano.
Yes, it's called vocal feminization.
Hey,
so
what?
There are guys who do that. There is, but yes, if you have a soprano, guys can make you have a bass. There are techniques and procedures done for people to do that to make your voice a bit deeper. Same thing with the ladies. If your voice is deep and you want it to become lower, that is possible. Yes, it's not cheap. That's the only thing I'll give you.
Is that a trend? You know, there's so many trends. It's hard to
At
keep
least
up.
so far it hasn't hit Kenya, but it's there in the West. It's a big thing.
Wow.
Whoa.
Interesting.
Doc, thank you for joining us. Dr. Nicholas Ngugi is ENT, neck and head surgeon. We've been talking about voice health and voice disorders. In the next hour, we talk about what? The Sovereign Wealth Fund.
Bill.
So there's a bill before Parliament, and that is what we shall be discussing. An expert is joining us coming up shortly. It's 8 a.m.